there are actually over 40 different visual skills where visual acuity or sharpness of sight is only one. So if you're only screening for one, right, look at all the other things, the other parts to vision that you're missing. And again, you can be like your son, right? Great, he can see 20/20 in the distance, but that just tells you one thing. How else are his eyes working to coordinate, to track, to focus? How does all that information then go to the brain? And then how does it integrate it with other sensory information, such as hearing, auditory processing, vestibular, balance information? And then with all of that information, the brain then tells the body what to do, right?
Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you so much for joining me today. I have a really special guest today, Dr. Lori Nishida. Doctor, thank you so much for being here with me.
Thank you so much for having me, Johanna. I'm really excited to share about vision.
Same here. And, I want to share with the audience a little bit more about your background, who you are, where you went to school, and how you got into this field. So do you mind spending a few minutes?
Sure. No, I'll try to keep it short. But I went to school at SUNY College of Optometry in New York, graduated in 1992. I loved retinal pathology, and I thought that was the path that I was going to go down, and I started that way. And then along the line, I have 4 beautiful children. My son is the third one, and he's our miracle child, an emergency C-section at 28 weeks. So 1 pound, 4 ounces. And all of the, as you can imagine, the developmental delays that came along, right? Health issues with being so premature, as well as vision. So vision is no exception, right? And so just like he needed speech therapy, occupational, right, all these things, and PT, right, his eyes and his vision needed help as well. So it was surprising to me how the school district, so once he was getting ready for kindergarten, the school district didn't understand and they had no idea. And so it was really a lot of challenge to get them to understand what he was going through and how they could support him in the classroom. So once I got down that road and saw that, wow, people really don't get it, that's when I turned down the road to vision therapy.
What an amazing story. So can you elaborate on what your son was experiencing in kindergarten? So as a mother, supporting him and wanting to know what he was going through and what exactly were some of the symptoms or signs?
Yeah. So because he was so premature, he was really so delayed in everything. So even his speech, right? So he wasn't able to say things like, oh, I can't see, or, things like that, right? So it was all observation with his behaviors, right? And that's a thing too, is that, right, when we think, oh, a child has a behavior problem, the behavior is not the problem. It's the symptom of a problem. Mm-hmm. So in his case, so we talked a little bit about, together, amblyopia or lazy eye, mm-hmm. right? And so that was his first issue that we discovered, is that he actually had amblyopia. And because he wasn't speaking, right, you couldn't get him to read an eye chart or even a picture chart, right? There was not that kind of communication. So we had to do a special test with him, an electrode test called a VEP, and it gave us an assessment of what his visual acuity or sharpness of sight was at that time, right? Mm-hmm. So his vision was so poor that he actually was considered to have a condition called low vision, right?
Oh,
Yes.
and so what was his vision actually? When you say it's low, what was that?
Oh, 2200 in one eye and 2120 in the other eye.
Oh my goodness.
So we think about 2020 as being perfect vision, right? The higher the number on the bottom, the poorer the eyesight, right?
So could he see?
So
at
he
all?
could see, right? But nothing was clear. His brain was not getting a good, clear image, right? Which affected everything else, right?
Of course.
So, because vision guides us in everything we do. So, yeah. So
and sometimes we take it for granted because it happens so naturally for us.
Right. Absolutely. Yes. So,
okay. So you figure out this is his vision. What is the step from there? Like what ends up happening?
So, really, the challenge was to help people understand what it's like for him, right? And navigating his world. So number one is, right? So just like an infant, right? What does an infant do? They grab a toy, they grab something, and the first thing they do is it goes in their mouth, right? Because a baby doesn't even have 20/20 vision. So vision develops as the child develops, right? So they explore with their mouth, right? So in my son's case, right, because he was so delayed even in his motor skills, right? So the ability to pick something up, he was really more just like a cute little thing that, just smiled all the time, right? So it was more seeing as he did get some, ability to grasp things and start to walk that really it was touching. He was touching everything and anything, right? Because that's how he was able to explore his world, right? Because his vision was not good. So then when you get into a classroom setting, right, it's keep your hands to yourself, right?
Yes.
And then so again, it looks like there's a behavior issue because he can't sit still and keep his hands to himself.
Yeah, that's actually, that's very interesting you say that because I experienced that with my daughter. And one of the things that the teachers would say is your daughter is highly sensory. Did you notice that with your son, because he didn't have the clear vision, he was overcompensating, right, with that, his other senses?
Absolutely. So in my son's case, he turns out to have autism as well. So he has a lot of different layers, to work through. But yes, absolutely. Lots of sensory issues, sensitivities, right? And so, so for him, it was very complicated. He was a very complicated case to try to explain, to teachers every year, and explain, why he does what he does and how could they try to support him in the classroom.
Wow, what a personal story. Now I understand why you do what you do so well. By the way,
thank you.
My children love you.
I love them too. Thank you.
And I know that you're very passionate about what you do. And there are some optometrists, when they do this vision therapy, the doctors themselves don't even do the therapy. They hire other therapists. So I was very pleased to know that when my children come to your office, they get to see you.
Correct.
And not a therapist.
Yes. And that's because it's my passion. I have a personal connection with it. I see how it literally changes lives. And so for me, it's like, it's so much more rewarding than anything else. And so, yes, I could hire other people to do it, but no, that's why I get up in the morning and come to the office.
I love that. So I want to talk about, from your experience and my experience as well as a parent with children, going through school, that vision test that they take every year. That's an eyesight test, correct?
Correct. It's just checking how clearly they can see from 20 feet away.
Which is barely scratching the surface.
Absolutely.
Right? So I guess that's a frustration I have because having both London and Ashton, the twins, realizing they also have vision therapy, learning differences, and only discovering that a few months ago through their own challenges of behavioral, emotional, issues in the classroom is why are we not testing for this? Do you feel this is something that we should test for in the school system?
That is such a great question. So number one, so even before they get to school, right, at the age of 5, but now TK with 4, they should be, right, having something done at the pediatrician's office, right? And so they do. So traditionally, the pediatrician, right, the nurse would check their visual acuity, right, 20 feet away. What's the smallest letter or picture they can see from that distance, right? Mm-hmm. And the criteria for passing, both for the school district and the pediatrician's office, is actually only 20/40.
Really?
Yes. So when you get that, I don't know if you still get letters home, right, from the school nurse's office, but if they can read the 20/40 line, they pass. And the deception, right, unintentional, but the deception is that parents see that letter and then they think, oh, that's great. My child doesn't have a vision problem. And they never think to take them for an actual eye exam, right? So that is just a vision screening, or they should call it a visual acuity screening, right? It's not even checking to see how clearly they can see up close, right?
Oh my goodness, I didn't even think about that.
No, it's just a distance test. Mm-hmm. So it definitely falls very short.
It does.
Right? Because there's so many other conditions that are then missed.
So we're talking about vision, and I actually, going back to this, Ashton, when I first started realizing maybe there was something more to this, would tell me, I can't see the board, I'm having a hard time. So my brain says, okay, well, let's go to the ophthalmologist and have your vision tested. So we get him tested, and it's 20/20. His eyesight's 20/20 perfect, but yet he's still rubbing his eyes. And I said to him, well, maybe you have dry eye. You know, I have dry eye. Mm-hmm. So I would give him like these natural lubricant tears that would make him feel better for a little bit, but he was still kind of scratching around his eye. And you know, when I really discovered this was with a combination of behavioral. So not wanting to go to school. He was in kindergarten. I don't know what kindergartner doesn't want to play all day or do arts and crafts, but he really was adamant about not wanting to go to school. And whenever he loves making paper airplanes, he would watch these videos, and whenever he would follow the instruction, usually it's top down. They'll start folding the paper from the top downward. Ashton would flip the page upside down and start from the bottom up. Or, which was, I found this very odd, he would tilt the paper horizontally and do it that way. So I found that a little bit odd. The teachers said, yeah, that's a little weird. I wouldn't worry too much about it. And I said, nah, I don't know. Something's going on here. So that's when we had him tested for vision processing and realized he was operating at 25% of capacity and my daughter at 40%. I could not believe this.
Yes, it's see, so the reason there are so many different parts to vision, there are actually over 40 different visual skills where visual acuity or sharpness of sight is only one. So if you're only screening for one, right, look at all the other things, the other parts to vision that you're missing, right? And again, you can be like your son, right? Great, he can see 20/20 in the distance, but that just tells you one thing, right? How else are his eyes working to coordinate, to track, to focus? How does all that information then go to the brain, right? Where vision happens. Vision is a brain thing. Mm-hmm. So how does the brain then take that information and process it, right? Along with visual experience, right? From the past and movement. And then how does it integrate it with other sensory information, such as hearing, auditory processing, vestibular, balance information, proprioception, which is where am I in space, right? Mm-hmm. And then with all of that information, the brain then tells the body what to do, right? Whether it's writing, whether it's catching a ball, whether it's where should I be looking when I'm reading, right?
That's crazy. So it's only we're only testing for 1 out of 40 things that our vision does.
Yes. Is it shocking?
It's very shocking, actually. I mean, we need to hopefully effect some change because I think you and I were talking earlier about the behavioral problems, the social emotional ramifications of these children growing up in a traditional school setting and feeling that anxiety of maybe not being good enough, not being smart enough. And that's not really the case. They're just not given the tools, or they have not been diagnosed, or maybe that is not their learning environment where they would thrive.
Right. So it's unfortunate that I think what we need in California, right? There are plenty of other states where the school system and the doctor's office, the pediatrician and eye doctors are more in sync. There are actually laws about, your child needs a comprehensive eye exam, right? Before they start kindergarten. It's a requirement, right? But not all states have that requirement, surprisingly, right? So it is a matter of educating, but also of pushing, right, the political part,
I
right?
agree.
Where we pass these kind of laws.
I agree. That makes sense because it would save us a lot more money if we're able to diagnose these learning differences early and address them early on.
Absolutely.
So I wanted to go over some statistics that I thought were kind of shocking. I read that 1 in 4 children, or about 25% of children, experience functional vision problems that can interfere with learning, reading, behavior, despite having the 20/20 eyesight. And this is because we were talking about the eyesight being 1 out of the 40.
That's right. Yes.
That's shocking to
It
me.
is.
And then I also read that more than 60% of children with learning difficulties have this undiagnosed vision problem. So we're not checking for this even later on once a child has been in education and just is not, picking up the curriculum, and maybe they've now mentally checked out and they're in detention all the time, or something else is happening.
Absolutely.
Right?
Yes. So with self-esteem is huge, right? Because if the child, for all intents and purposes, looks like he can see, there's no problem with his visual system and how the eyes are working, the assumption is, well, you're just not trying hard enough. And I've actually had children come in at a later age for their first eye exam because the parents are so frustrated because they don't understand why their child isn't doing better academically. They're perfectly capable, according to the parents, and they must just be lazy and not care, right? And the teacher can kind of chime in on that as well, right? Why don't you try harder? You're just not trying, right? And I've also had students where sometimes they can do it, right? They put in extreme amount of effort and they get that good grade. And then the next time they don't. And then again, it's the same thing, right? It's the assumption that, well, you just didn't try hard enough this time, right? And so it does affect their self-esteem.
That's really sad. And thinking about my relationship to my children and the vision therapy diagnosis, like the learning difference diagnosis, I am just so thankful that I said to myself, because Ashton can do math in his head. And, yet when it comes to stringing words along and reading, that's when I noticed the struggle, the frustration tolerance was short, and he was very dismissive about trying to read. And what I said to him was, I know something's going on. It never, thank God, got to a point of me saying you're not trying hard enough. I just kept digging and digging and digging. So I have so much compassion for those children. But I'm sure once you were able to help them, there was a huge boost in confidence, right?
Absolutely. So I commend you for that, right? Because it is easy to take the other route, right? And just assume that there's a behavior problem. But yes. And why do children, right, avoid like that, right? Why don't they want to do that, right? So it's because it's too hard, right? So if anything's too hard, right, it's not very fun if I'm not good at it, right? So therefore, I don't think I want to do that, right? That's one scenario. The other one is that your eyes can literally get so tired from working so hard to focus, to track, to coordinate, that it makes you tired. And then your mind wanders, right? And the natural thing to do is to stop it because it doesn't feel good.
Yeah,
right?
so that
Yes.
I noticed that's what was happening too with both my children, because I brought Ashton and London in after school individually, and they were rubbing their eyes, and you said, you know what, Johanna, they're extremely tired from being at school all day, working so hard. And so now we do the vision therapy in the morning, first thing when they're bright and ready to go, when they have the most strength in their eye, the most attention for the day.
Stamina.
Stamina.
Yes.
So that helps. I want to talk about also what vision therapy treats and how long a protocol might be for like a patient. Obviously, it's individualized, right? But I'm sure there's like a guideline of what you generally like to see in terms of a patient when they start vision therapy. So I read that it treats convergence and sufficiency. And what is that? Is that like bringing the eyes together?
Right. So the binocularity is what is termed for eye teaming skills, right? So the two eyes should work together in sync, right? And so when we look at something up close, right, which is again, if we're thinking about that distance visual acuity test, right? Okay, what are your eyes doing, right? They're like this. But then the closer you look at something, right, the more your eyes actually turn in or converge,
I
right?
see.
So when the child's looking up there at the board or the teacher, right, and the teacher may say, okay, now write this down, copy this down, right? Their eyes have to converge just the right amount to be able to focus and see clearly at this distance, whatever that distance is for them, right? And so if they either can't do that or they can't sustain it for very long, right, then you get this either the eyes start to diverge, right? And they can see double. It can look like words kind of actually shake or move around on the page. They lose their place reading. I mean, yes, convergence insufficiency is huge.
Now, what is, I'm going to butcher this, but I'm going to try to pronounce it, strabismus.
Strabismus. Yes. No, that was pretty good.
Okay, good. What is that?
Strabismus is where an eye points in a different direction from the other eye.
I see.
So it can be anywhere, eye going out, in, up, or down, or a combination.
How often do you see patients that way?
I would say the majority of my patients have more of the tracking, focusing, convergence, eye teaming skills problems, but we do get patients also who have strabismus. So yes, we can work on strabismus as well with vision therapy.
Okay, so we talked about eye movement disorders, visual processing delay. Now, I'm interested in this because my children are experiencing this. So how do the exercises help retrain the brain?
That's a perfect question.
Can you give me a good example? Because that's really the heart of what you do.
Absolutely.
Right?
It's not a muscle thing like I have weak muscles, so like let me go to the gym and pump some iron, right? It's not that. It is a brain thing because vision is a brain function. So basically where we start, right, which you have seen, right, with the kids, is that we work on their visual skills first, right? That's what we call them. Fixation, focusing, tracking, eye teaming skills, right? Because if the information that the eyes are gathering and sending to the brain is inaccurate or faulty, right? How does the brain then interpret faulty information and then be able to tell the body how to react to that faulty information, right? So it kind of just goes all the way down the line and you don't end up with a good result, right? So basically, if you kind of think about like your phone camera, right? I'm sure we've all videotaped, right? And if you're kind of shaky, right? It's not easy to watch that video.
That's right. It's very distracting.
Yes, it is.
You'll
and
get a
it takes
headache.
so much effort, right? And after a while, okay, I think I'm done with that, right? And the same thing with the eyes. So if the information coming into the brain is not accurate, the brain already is at a disadvantage to try to interpret that information, right? Now, let's say the person actually does have good visual skills. And so the information coming into the brain is accurate, but the brain is not processing, interpreting that information correctly. And then so again, the result is the same, that the motor output is not the desired outcome, right? So even within visual perception or visual processing, right, there are 7 different categories to visual perception. So it's not just working on one thing. So things do go in an order, right? So if we don't have good fixation, the ability to actually look where we want to, our focusing, our tracking, everything will be off after that, right?
I see.
And then with the visual processing, the first or basic one is visual discrimination. Does the brain have the ability to discriminate between 2 similar things, right? So we can even get into the B and D issue, right? They look very similar, right? And so if the brain has difficulty with any of these going all the way down to number 7, right? There will be problems. It's going to take longer, right, for someone to get their work done because their brain actually is taking longer to process that information, right? And then again, what is the quality of the motor output? So you mentioned about the handwriting, right? So again, right, if the information coming in or how the brain processes that information is not correct, right? Then again, you're going to get letters that are squished together, kind of jumbled. Some are bigger, some are smaller.
That is
They're
so
going up in the
interesting.
air, right off the line. They're coming down below the line.
That is so interesting. So that's called, is it that called dysgraphia?
No, it's not the same. Dysgraphia is the inability to actually write.
I see.
Right?
But we're actually talking about just the processing.
Right.
So London,
eye-hand coordination.
Yes, London's letters were massive. They were so large on the page, and the frustration that she had was, I'm not able to put down on paper with my hand what I'm seeing. And she would just get so frustrated. And that was another one of the signs of, for me, the visual processing, that maybe she needed support there.
Right.
This is very interesting. So, doctor, for parents that are watching this episode, what are 5 top things that they should maybe pay attention to see if their child might need support with their visual processing?
Yes. I think number 1 is just behavior, right? Avoidance of tasks, whether that's academics or sports, right? Anything where spatial judgment is required. I think also just watching, observing your child, right? So from, like you mentioned, a lot of eye rubbing, a lot of blinking, excessive blinking is a common one as well. The turning of the head, right? Or tilting of the head. A lot of times parents think that, well, yeah, they do this because they just want to be cute. But it's actually because there's a vertical misalignment in the eyes. And over time, they learn that, oh, this is so much better. But they don't know how to voice that, right? And then I think just the closing of one eye, right? So sometimes kids actually kind of wink, or they're resting their face on their hand, and they actually end up closing one eye, right? Because of double vision. So I think all of those things together, right, including inconsistent performance, whether it's academics, right, or sports. But the other thing too is that sometimes parents are kind of confused because, let's say their child did do well in the early grades, kindergarten, first grade, second grade. Oh, they're a straight A student. They're awesome, right? They love to read. And then somehow in third grade, where things get a lot harder, right? The material they're learning is more challenging. They get a lot more homework, right? So third, fourth, as you keep going up, right? There's a lot more visual and cognitive demand on the child, right? So at some point, their visual system just isn't able to tolerate anymore. The load is too great. And this is when you start to see grades decline.
Wow, that's very interesting. Yes. So it's possible that the visual processing that the child has in the lower grades is sufficient to get them by. But as the workload and the demand increase, there could be a decline. And that is where it could get confusing for parents, I think, where they feel maybe their child's not trying hard enough.
Exactly, yes.
Wow, that's very interesting.
It is. It's amazing.
Vision
is huge.
It's huge and taken for granted. I'm going to tell you right now, doctor, I did not know to the degree how much vision and processing played a role, because I was fortunate in not having visual processing. And in fact, I forgot to mention this so far, is that when Ashton and London had their diagnosis, I went to my husband and I said, I think you should get tested for visual processing, learning difference. And he goes, what? I'm 49 years old. Why do I need to do this? And I said, well, first of all, I think, all the stories you tell me about how you hated school, you didn't like to read, you've never picked up a book, you cheated on every test. Maybe this was it, because you're successful and, you're smart. And he said, okay, if you think it would help kind of bring more data and information and possibly why the kids have it, I'll take the test. A week later, he went in and he was assessed for visual processing, just like Ashton. He's operating at 25%. And I said to him, why don't you do the therapy? I mean, if anything, you don't know what you don't know. So if there is, something that can help alleviate stress, anxiety, maybe this is part of why you have some anxiety over reading things or going through, long emails and texts and things like that. And so he actually started to do the therapy himself. So I'm so proud of him for doing that.
That's amazing. Yes.
Yeah. So do you find, doctor, that visual processing or vision issues are genetically passed down? Do you find
Yes, many times, yes. So if we ask, does anyone else in the family have similar issues with vision problems? We don't just look at the parents, right? It could be the parents, it could be a grandparent, it could be an uncle. And so unfortunately, if nobody bothered to test though, right? Yeah. So you're really an investigator. So another question a parent could ask is, that's right. My brother never liked to read. He didn't want to go to college, right? Those are clues. Those are big clues, right?
Yeah.
Because again, if we're good at something, we want to continue to do it, right?
That's right.
So even if a child has the ability to make it through high school, right, kind of skim by and graduate, they're very unlikely to be that one that goes to college, right? And maybe that also affects their trajectory in life, right? Mm-hmm. And yeah, I tell people, if you're a truck driver, it doesn't matter if you have convergence insufficiency, right? Because you're not sitting there in front of a screen or in front of paper at a desk all day, right?
Well, it's never too late.
That's right.
I think that's a good message.
Absolutely.
Well, doctor, thank you so much for being here today.
Thank you,
really
Johanna.
Enjoyed this.
Oh, I love vision. I love sharing. So yes, thank you so much for having me on.
Of course. And also, would you mind telling the guests where they can find you online?
Oh, sure. So my website is www.burbankvision.com. And I'm right in Burbank, California. So
amazing.
Yes.
Thank you so much.
Thank you.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.